Hi class, this presentation is by Valerie Gonzalez, Andrea Maldonado, Roselia Perez, Celeste Rivadeneira, Jylon Rush, and McKenna Tucker. We will be presenting and discussing the prevalence of hepatitis A among adults ages 20 to 30 in the United States between 2010 and 2018. So as illustrated in the graph, the United States has been experiencing a mostly downward trend in the incidence of hepatitis A. The hepatitis A vaccine first became available in 1995, causing the rates in the United States to steadily decline. This downward trend remained steady until 2011, when the first increases since the vaccine were experienced. This increase lasted until 2013, when a large multi-stage outbreak occurred. In 2016, another increase occurred and was linked to outbreaks caused by hepatitis A contaminated food. The estimated number of reported new hepatitis infections in 2016 was 2,000. According to the CDC, out of the 2,007 case reports of hepatitis A that were received, the top 3 risk behaviors reported were international travel, injection drug use, and men who have sex with men. Of the 826 case reports that included information about travel, 34, or 4.1%, indicated that they had traveled outside of the United States or Canada. Of the 544 case reports that included information about drug use, 3.5% indicated use of injection drugs. Of the 102 case reports from males that included information about sexual preference and practices, 8, or 7.8%, indicated that they had had sex with another man. Men who have sex with men are especially at risk for hepatitis A.
In the case of hepatitis A, the virus has a history for being a huge problem since 1971 when the U.S. had the largest outbreak. Over the past years, hepatitis A was declining tremendously due to the vaccination available for children. According to the United States Department of Health and Human Services, hepatitis A virus infection reports from 2012 to 2016 shifted up and down due to the large outbreaks. The increase in reports were linked to multiple state outbreaks of pomegranate arrows reported from Turkey. Between 2015 and 2016, another increase of hepatitis A virus was due to the outbreaks reportedly connected to imported foods. In 2016, there have been 4,000 reported cases of hepatitis A and 70 reported death certificates that affirm hepatitis A virus was the cause of death. Therefore, hepatitis is still putting the U.S. population at risk due to international traveling, food importation, and an unvaccinated population. Hepatitis A vaccination costs and medical bills of an infected person have contributed to the total economic cost for this health problem.
The primary causative agent of hepatitis is hepatitis virus. The virus belongs to the toxins such as excessive medication and poisons. These substances cause inflammation of the liver. Hepatitis A is transmitted through the fecal-oral transmission, which is when a person who is not infected with hepatitis A ingests food or water that has been contaminated with the feces of a person who is infected with hepatitis A. Hepatitis A is common in family settings where an infected person is cooking with dirty hands. Hepatitis A is common where sanitation and hygiene is poor. Moreover, hepatitis A can also be transmitted through close contact with an infected person.
Next, I'll be discussing the mechanisms to control hepatitis A. Currently in the United States, we're controlling and preventing hepatitis A primarily by vaccinations, screenings, and education. First, babies that are aged 1 or older are given the hepatitis A vaccine. This is a 2-shot vaccination that will guarantee protection from this virus. This primary prevention measure has been the most successful way of controlling hepatitis A. Another way the United States has battled high rates of hepatitis A outbreaks is through health programs such as in several restaurant chains in Ohio, Kentucky, and West Virginia, where they've implemented health programs using primary prevention to reduce the prevalence amongst restaurant guests and employees. In hopes to reduce the number of existing cases, the employees are offered a voluntary free hepatitis vaccine, and restaurants hold meetings daily to discuss and reinforce measures of sanitation, including regular hand washing and utensil sanitation. Secondary prevention for hepatitis A is also screenings done in workplaces before hiring an employee. Most companies and workforces such as food service establishments, child care centers, healthcare institutions, schools, and workers exposed to sewage all require hepatitis A vaccinations before being hired. Lastly, one way that hepatitis A is controlled by the tertiary level of prevention is when you're exposed to hepatitis A, you can have your doctor administer an immune globulin shot. This shot contains antibodies that fight against the infection, and this can also be done 2 weeks after hepatitis A exposure.
Host characteristics. Hepatitis A can infect anyone, but there are people who are at greater risk. Here are a list of the host factors that are associated with hepatitis A that we will be going over. First being race and ethnicity, then gender, then age, and lastly risk behavior and exposure. In regard to race and ethnicity, this figure from the Centers for Disease Control and Prevention will help illustrate the group who is vulnerable to hepatitis A by looking at the trends in the incident rates. We will focus on the more recent years from 2010 to 2016, but let us acknowledge how the decreasing trend from 2001 began shortly after the vaccination was introduced in 1995. That is according to the Centers for Disease Control. If you look at the trend, you see the orange line, who represents Asian and Pacific Islanders in recent years, have had higher rates in the incidents reported compared to all other races and ethnicities listed. From 2015 to 2016, the rate for Asian Pacific Islanders increased from 0.6 cases per 100,000 population to 1.5 cases per 100,000. The World Health Organization alludes that these individuals travel to countries where hepatitis A is prevalent, like Asia, and consumption of raw shellfish within these cultures is another reason for incidence in Asian Pacific Islanders to be higher. Now look at this figure that demonstrates incidence between males and females in the United States. The trends and rates look similar throughout the years. In 2016, reported cases increased, but males had slightly higher rates. This signifies that both genders are at risk, but males are slightly more. The World Health Organization and CDC find some relation in male behavior and their vulnerability to hepatitis A. For instance, males are more likely to use injection drugs, and the sexual behaviors of men who have sex with men increase the vulnerability for males. Let's look at age as a host factor. Each age group from birth to over 60 years have reported cases of incidence. If you can see, that yellow line represents 20 to 29-year-olds. That line is above all others because they have the higher incident rates. This means 20 to 29-year-olds are the vulnerable age group. The CDC reports that age group have higher prevalence because their risk behaviors exposes them to hepatitis A. That is why our target population is focused on 20 to 30-year-olds. Now let us look at environmental variables. Environmental variables are factors that make people vulnerable in regards to geographic areas, social and economic factors, and culture, just to name a few. Scientists and public health agencies do not have much research and information about the social and environmental factors that make adults 20 to 30 years old or any population vulnerable to hepatitis A. According to the U.S. Department of Health and Human Services, only 7% of hepatitis A cases had an identified risk factor. The rest of the 93% reported cases that lacked data or had no identified social risk factor. According to the Centers for Disease Control, the World Health Organization, and Moyer's American Epidemic Journal article, here are a compiled list of environmental risk factors. In regards to the culture and social part of environmental variables, international travel, substance abuse users, and men who have sex with men are susceptible to Hep A. Economic environmental variables are reflected of those with a low socioeconomic status, infection through personal contact because of living conditions, and employment in child care services, as well as the homeless population. We lack data linking environmental factors with hepatitis A, which makes risk behaviors seem to have a higher association with this disease.
To begin, I'll be talking about temporal variation. According to the World Health Organization, in its viral state, hepatitis A is extremely contagious and one of the most common causes of foodborne infections. If water contamination occurs, the chance of an epidemic is highly likely. An epidemic is a widespread of onset disease affecting a lot of people in the same time frame. These epidemics can occur sporadically, but typically outbreaks commence in fluctuating increases and decreases of repeating cycles known as cyclic patterns. Although definite temporal variations are unclear, there may be some sort of correlation of hepatitis A occurrence with the spring and summer months. During this time, there is an increase in water activities such as swimming, summer travel to areas that the disease might be persistent, as well as a change in food habits which relate back to the fecal-oral mode of transmission. Next, I'll be going over gaps in knowledge. Hepatitis A is a well-known disease in the United States, and there is a lot of information accessible to the public. For example, awareness, prevention strategies, and treatment options. Hepatitis A is considered a preventable disease in the United States and is considered so because researchers know the cause of the disease, how to treat it, and ways to prevent it. There has been an increase in hepatitis A outbreaks over the last 3 to 5 years. However, imported foods from other countries have been confirmed as the cause of these recent outbreaks. In short, there seems to be nothing missing from our knowledge of hepatitis A.
Since epidemiologists and researchers have the same goal and assist each other with the analysis of the data and research conducted, they can assist each other on ways to further their research. The causes of the disease have already been identified, so now the implementation of programs are essential in order to decrease the incidence rates of hepatitis A. There has to be a focus on how to overcome the restraining forces of an issue. With the vaccination existing, one can predict the decrease of incidence rates of hepatitis A for future generations. Epidemiologists need to keep track of the data collected with new programs that are being developed in order to adapt them in ways to maximize their effectiveness. Since hepatitis A is the most common form of the hepatitis virus, there should be more research done within the population of 20 to 30-year-olds. Within the past few decades, researchers have noticed a decline in infection rates due to those in lower socioeconomic groups having access to filtered water, getting into a better socioeconomic state, and finally having access to the vaccine. Having aid and financial support for this disease could decrease the incidence rates drastically, which eventually can eradicate the disease. Until the year 2012, hepatitis A followed a consistent trend where the disease was decreasing. Unfortunately, from 2012 until 2016, the disease has reemerged in all U.S. states. With a $100 million grant, economic support would go to areas in the United States that have previously had high rates of hepatitis A. The target population would be adults ages 20 to 30 years old who are at high risk due to their behaviors, which often include drug use and which could lead to homelessness. Those who travel often and men who have sex with other men are also at a higher risk. It is important to enforce the vaccine amongst the nation to control and prevent hepatitis A for future generations. If there is any excess money from the grant, it could be used to adopt the program to certain locations in sub-Saharan Africa, where there is a lack of access to clean water and hepatitis A affects them drastically. That and the combination of readily available vaccines would decrease the risk factor of getting infected with the virus. With the goal of vaccinating everybody at risk and providing clean water sources to those in need, one may potentially eradicate that form of the virus. Receiving a $100 million grant would be a step in the right direction in hopes of decreasing the prevalence of this disease.